Bismillahirrahmanirrahim. Assalamu alaikum everyone. Myself Dr. Fahim Imtiaz, 2021 DBM 108 Group C1 Morning. I will present you a rare case study of aggressive behavior in female alpaca. Alpaca belong to camelid family like camels. The case presentation: 10 years old female alpaca, 57 kg weight, sexually intact. What was the main complaint? She was aggressive towards the herd for 3 to 4 months. Progesterone level was 10.49 nanogram per ml. Very high progesterone level, but in pregnancy there is greater than 2 nanogram per ml progesterone level. But she was not pregnant because she had no male exposure since last breeding of 1.5 years ago. Means she had 1.5 years ago last pregnancy. What was the clinical findings? Normal vitals, temperature, heartbeat was normal, but respiration rate was mild increased. She was sedated using xylazine chloride and ketamine chloride, hydrochloride for transrectal ultrasonography. What was the findings? On ultrasound, we can see on the right ovary in the figure given below, white colored circle. There is a in white colored circle there is a white line in the center separating the structure, looking like the mediastinum testis. The whole right ovary structure has size of 17.6 mm. The mass that is appearing in the right ovary, it has size of 17.6 mm. But on the left ovary, there are two white structures appearing in the white circle. These have size of 3.28 and 5.41 millimeter. Uterus should have anechoic fluid. According to her progesterone level, 10.49 nanogram per ml, should appear uterus anechoic. But uterus was normal, non-pregnant appearance. There was no fluid found in the uterus. What was our diagnosis? Our diagnosis was persistent corpus luteum, pseudo pregnancy. You should know that the alpaca have Easter cycle of 15 days. Usually what happens is the CL after ovulation. After ovulation, CL regresses about 8 to 11 days by the PGF2 alpha, which is released from uterus endometrium. If there is any uterine infection going on, the PGF2 alpha is not released, then CL is not regressed, and CL on the ovary increases in size, suppresses the follicular wave. We can confirm it through histopathology. Histopathological findings were multiple corpus luteum structures, tissues were found, no evidence of ovarian neoplasia. If there is any ovarian neoplasia, we can also confirm it through histopathology. What was the differential diagnosis? Pseudo pregnancy by persistent corpus luteum that was due to absence of PGF2 alpha, which should be released from the uterus endometrium. Granulosa cell tumor. These are also ovarian cell tumors. These cause increase in estrogen production. Estrogen production lead to the male-like behavior. Very high estrogen level. If there is very high estrogen level, the alpaca will show the signs of male-like behavior, aggressive behavior. If there is any Leydig interstitial cell tumor, the alpaca then also shows the signs of aggressive behavior, male-like behavior. But difference is somehow single word difference. Granulosa cell tumor, also ovarian cell tumors, Leydig cell tumor, also ovarian cell tumor. But difference is of hormones. Granulosa cell tumor causes increase in estrogen levels. Leydig cell tumor causes increase in testosterone levels. But in our case study, we did not found the increase in level of estrogen nor the increase in level of testosterone. So they were regarded as only differential. They were not present in this case. In this case, we found only the persistent corpus luteum tissue. What was the treatment? They did ovariectomy, bilateral laparoscopic ovariectomy. They removed the ovaries to overcome the aggressive behavior. There was good recovery, and we can see in the figure that left ovary had two structures, corpus luteum, small structures. Right ovary had large structure, corpus luteum, that suppressed the follicular wave and showed the apparently animal showed the signs of pregnancy and aggressive behavior. On the right ovary, we can see the big structure, corpus luteum. Animal was discharged after 4 days. Discussion point of view, ovarian tumors rare in camelids. Camelet does not have ovarian tumors. but very rare cases. Hormones inconsistent with neoplasia. If there is any neoplasia, then the hormones show inconsistency in production, either increase in levels or decrease. Likely luteal persistent from uterine dysfunction. There might be some uterine dysfunction. That's why the CL was persisted due to absence of PGF2 alpha. Prognosis and outcome. Behavior normalized in 4 months. After 4 months of ovariectomy, animal was completely recovered. No aggression, but animal fell ill, so they decided to euthanize it. If you have any question, you are more than welcome to ask.